Now let's move on to the last problem on the destruction of life, the euthanasia and physician-assisted suicide. Death is usually considered an evil, perhaps the greatest evil, but many think it can be a blessing if it spares someone from a slow, horrific dying or a hopeless vegetative sleep. What is euthanasia? I guess you are all familiar with this, but here is the definition. The term derives from the Greek word meaning good death, and it evokes the idea that causing or contributing to someone's end may bestow on that person a good. It can be characterized as directly or indirectly bringing about the death of another person for that person's sake. So you are causing death to someone which can be considered as a benefit by that person. Now, many philosophers maintain that there are two forms of euthanasia. These are the active euthanasia and the passive euthanasia. In active euthanasia, it is said to involve performing an action that directly causes someone to die, what most people think of as mercy killing. So here in active euthanasia, you are doing harm to the patient in order for that patient to die. So you are actually killing the patient. The good example for this is administering a lethal injection to end the patient's suffering. Whereas in passive euthanasia, it is allowing someone to die by not doing something that would prolong life. So here you are letting the patient die through a natural process, without an act or element of killing. Here you are withdrawing or withholding necessary life supports or treatments. Example for this is removing a patient's feeding tube or ventilator, failing to perform necessary surgery, and refraining from giving life-saving antibiotics. In short, active euthanasia is killing, but passive euthanasia is letting die. To some people, this conceptual border between active and passive euthanasia is crucial for assessing the morality of euthanasia. They point out that whereas letting a patient die is sometimes morally permissible, deliberately and directly killing a patient is always wrong. That's why active euthanasia is illegal while passive euthanasia is legal and officially endorsed by the medical profession. The usual view is that passive euthanasia can sometimes be performed by disconnecting a dying patient's feeding tube or ventilator. But this event can also be seen as an instance of performing an action that directly causes someone to die, which is the active euthanasia. Now, if euthanasia in some form is morally permissible, its permissibility must be linked to the patient's consent. So the patient's consent has always have to do with euthanasia. That's why bioethicists talk about euthanasia that is voluntary, non-voluntary, or involuntary. Voluntary euthanasia refers to situations in which competent patients voluntarily request or agree to euthanasia, communicating their wishes either while competent or through instructions to be followed if they become incompetent. So it is the patient's voluntary choice to explicitly request for euthanasia to a doctor or a nurse. Patients can also indicate what is to be done in incompetence by formulating an advance directive. It is usually a living will or a document designating a surrogate or proxy to act on their behalf. While non-voluntary euthanasia is performed when patients are not competent to choose death for themselves and have not previously disclosed their preferences. In these circumstances, the patient's family, physician, or other officially designated persons decide for the patient. Incompetent patients include not only incapacitated adults but infants and small children as well. Then involuntary euthanasia is bringing about someone's death against her will or without asking for her consent while she is competent to decide. So here, the patient's consent is not involved in deciding for euthanasia. Hence, involuntary euthanasia is illegal and considered morally impermissible by both those who approve and disapprove of euthanasia. Now, combining those early kinds of euthanasia, there are 4 kinds of euthanasia that have been the main focus in bioethics. These include active voluntary euthanasia, active non-voluntary euthanasia, passive voluntary euthanasia, and passive non-voluntary euthanasia. In active voluntary euthanasia, it is directly causing death with the consent of the patient. So you're actually killing the patient with his or her consent. While in active non-voluntary euthanasia, you are killing the patient without his or her consent. Next is the passive voluntary euthanasia. It is withholding or withdrawing life-sustaining measures with the consent of the patient. And in passive non-voluntary euthanasia, you are withdrawing or withholding life-sustaining measures without the consent of the patient. All in all, active euthanasia, whether voluntary or non-voluntary, is unlawful, while passive euthanasia, both voluntary and non-voluntary, is legal provided certain conditions are met. Physician-assisted suicide. So what is physician-assisted suicide? It is when a patient takes his own life with the aid of a physician. In a typical scenario, a patient asks the physician for help in committing suicide. The physician assists the patient by prescribing lethal doses of drugs or explaining a method of suicide, and the patient, not the physician, performs the final act that causes death. So in contrast, in active euthanasia, the physician performs the final act, while in physician-assisted suicide, the patient himself or herself performs the final act that causes death. Many argue that this difference in the ultimate cause of death implies a difference in moral responsibility. In physician-assisted suicide, the patient is thought to bear the ultimate moral responsibility for the taking of life. Others doubt that any distinction in ultimate causes can amount to a moral difference. Thus, they contend that physician-assisted suicide and active voluntary euthanasia are morally equivalent. They concluded this through the question, what is the moral difference, they ask, between a physician helping a patient die by administering a lethal injection upon request or prescribing a lethal dose of medications upon request. So active voluntary euthanasia and physician-assisted suicide are really a controversial and sensitive topic, but don't worry, we are not really focusing on this because physician-assisted suicide is rare. Almost all countries does not legalize this. There are only few states in the USA that legalizing physician-assisted suicide. These include California, Oregon, Washington, Montana, and Vermont. Here in the country, euthanasia and physician-assisted suicide are illegal. Here, it is a crime, specifically a murder. In 1997, the Senate considered passing a bill about passive euthanasia, and in 2013, the late Senator Miriam Defensor Santiago filed a bill about passive euthanasia, but then it died in the Senate because of the church's strong opposition.